All right, today we're diving into a story that's been unfolding for 50 years, a quest to completely revolutionize medicine. We're talking about making our treatments smarter, more precise, and it's this incredible tale of chemists, engineers, and doctors all coming together to tackle one huge, fundamental problem.
I mean, just think about it for a second. What if we could send medicine exactly where it was needed? Imagine targeting a single cancer cell, and only that cancer cell, leaving every single healthy cell in your body completely untouched, right? That one question? That's basically the holy grail of drug delivery. And it's the driving force behind the amazing science we're going to get into.
See, the problem that most of the drugs we're used to is, well, they're kind of like a shotgun blast. You take a pill, you get an injection, and that medicine just floods your entire system. It goes everywhere. And that creates two huge problems. First, the effect doesn't last very long, so you have to keep taking more doses. And second, you get all those nasty side effects, right? That's because the drug is hitting all your healthy cells just as hard as the sick ones.
So the solution to this shotgun problem really started taking shape about 50 years back. And it all came down to a brilliant idea, something called controlled release polymers. This was a huge deal, bringing together scientists from all different fields to build these, well, platforms that could deliver drugs in a really controlled, sustained, and targeted way. This whole story really unfolds over 3 distinct eras.
Okay, so let's start at the beginning. The journey kicks off back in the 1960s with what we'll call the macro era. And when I say macro, I mean it. We're talking about big, visible devices, things you could literally see and touch. And they were designed to solve a problem that, let's be honest, we've all had, just forgetting to take your medicine on time. So what exactly is a controlled release polymer? Well, think of it like this. It's a special material that's engineered to work like a tiny, tiny time-release capsule. You can almost picture it as a dissolving cage that's holding the medicine. And instead of just bursting open and releasing everything at once, this cage either slowly breaks down or lets the drug seep out at a really precise, steady rate over time.
A really classic example of this is Norplant. Maybe you've heard of it. It was this contraceptive implant made of 6 little silicone tubes that were placed right under the skin of the upper arm. And what they did was just steadily release hormones, providing super reliable contraception for up to 5 years. That's amazing. Now, this was a huge leap forward. I mean, think about it. For the very first time, a single treatment could give you consistent therapy for years. It totally solved the whole patient compliance problem. No more worrying about missing a pill every single day. For any kind of long-term treatment, this was an absolute game changer. But you know, even though they were revolutionary, these early implants had one pretty big drawback. They were made of stuff like silicone that doesn't break down in your body. And that meant, you guessed it, they had to be surgically removed once all the medicine was gone. And that limitation is exactly what sparked the next great innovation, the micro era.
The big idea here was, well, it was simple, but absolutely brilliant. What if the polymer could just dissolve safely inside the body after it finished its job? This idea of making them biodegradable meant no more surgeries for removal. The whole delivery system would just break down into harmless stuff the body already knows what to do with, like water and carbon dioxide.
And the real star of this era is a treatment called Lupron Depot. It's basically an injectable system of these tiny microparticles made from a biodegradable polymer known as PLGA. It's used to treat things like prostate cancer, and a single shot can deliver a steady, consistent dose for up to 3 months before it just safely dissolves away. I mean, this completely changed the game for managing chronic diseases.
Okay, now the next step we take is a giant one. We're going from microparticles, which are already tiny, about the width of a human hair, down to nanoparticles. We're talking about technology that is thousands of times smaller. This is the nano revolution. And this is where we start building what you can really call smart packages for our medicine.
And these little things are just incredibly sophisticated. A modern nanoparticle has like 4 key parts. First, you've got the polymer core. That's your cargo container. Then inside, you have the drug payload. That's the actual medicine. The outside surface is coated with a polymer, often something called PEG, which works like a stealth cloak, hiding it from your immune system so it can stick around longer. And then, and this is the coolest part, the most advanced ones have a targeting ligand. Think of it as a molecular GPS system that's programmed to find and lock onto specific diseased cells.
So how did these smart packages actually find their target? Well, there are basically 2 main strategies. The first is called passive targeting. It's clever. It basically takes advantage of the fact that tumors have really leaky blood vessels, so the nanoparticles can just sort of seep in and build up there.
But then there's active targeting, which is even more precise. This is where that molecular key, the ligand, comes into play. It physically seeks out and unlocks a specific receptor on a cancer cell's surface, like a key fitting into a lock.
And the results? I mean, they're just staggering. For instance, a targeted nanoparticle they developed called Bind-114, it was shown to deliver up to 10 times more of a chemotherapy drug directly to tumors than if you just gave the drug the old-fashioned way. Just let that sink in. 10 times more medicine hitting the target. That means way more power where you need it and way fewer side effects everywhere else.
Okay, so let's just quickly recap this whole journey. We started in the macro era, which gave us that awesome long-term release, but you needed surgery to get the implant out. Then the micro era fixed that with injectable, dissolvable systems. Huge improvement, but they still weren't precise enough to target individual cells. And now we're in the nano era, which has given us that incredible cellular-level precision, even though there are still challenges to figure out. You can really see how each step just builds on the last one.
So where do we go from here? What's the next frontier? Well, we're starting to move beyond just targeted delivery to on-demand delivery. Think about that. We're talking about medicine that doesn't just go to the right place, but that only acts at the exact right time. This is the wild world of smart release triggers. Just imagine a nanoparticle that's just floating around in your system, totally harmless, until it senses the specific acidic environment of a tumor, and only then does it unleash its medicine. Or, get this, a particle that stays completely locked and loaded until a doctor activates it from outside your body, maybe with a focused beam of heat or light or ultrasound. The medicine would be released precisely on command.
You know, researchers in this field have a name for this. They call the ultimate goal full spatiotemporal control. It sounds complex, but it really just means having complete control over where and when our medicine works. It's all about creating treatments that are perfectly in sync with your body and with the disease itself.
So, this 50-year quest has taken us from these kind of bulky implants all the way to what are essentially intelligent, cell-targeting nanobots. It's incredible. And it leaves us with this one final, fascinating thought to ponder. What happens when we actually get there? What happens when our medicine finally becomes smarter than our disease?